Good evening. First of all, I acknowledge my civic team to make this presentation here. So, how we used this RTA as a tool in this project for our intervention in health to enhance the health services. So, our objective of intervention was facilitate better access service to services among the urban poor. We concentrated in 2 urban slums where the people access the primary health center from the public health centers, and increase community participation to achieve transparency and accountability. Transparency and accountability will not come from the government agencies unless and until the community asked for this transparency. So the strategy of civic is this. Our main concentration or the tool is RTI for systemic change in any department, mainly focusing health and food distribution, PDS. First, we try to give the grievance redressal mechanism in each service center, in even PDS and health. So, in each of them, though there are government orders to conduct grievance mechanisms, systems and install in the service agencies, there is no grievance redressal mechanisms. How to give the application for grievances if I didn't get any services in the government agencies. So for this, we developed a platform and conducted grievance redressal melas, where we called the public officers, concerned department officers, and also the community who access these services. And there, we made them the officers to provide the awareness on the schemes or facilities provided to the community, and community whether they were able to access those services with the transparency was the things. If there was the grievances, the applications were given on the stage and made accountable that officer to solve those grievances. Another, to strengthen the participation platforms, where we are trying to empower Vigilance Committee or Board of Visitors. Vigilance Committee is formed under every PDS shops, where the members of Vigilance Committee members will be the PDS card holders. So these members, card holders, doesn't know they are the members of this Vigilance Committee. They will be signing some books for meetings and the things, but they don't know why they are signing. And another was Board of Visitors for hospitals, that to tertiary hospitals. And primary health centers, there were no any grievance participation platforms. Board of Visitors consisted of some members of Rotary or some doctors, where they visited the hospitals once in a year or twice in a year, where they never took care of the services provided in that hospitals. For taking the transparency or bringing transparency in the public services, we targeted through RTI on suo motu declaration under Right to Information Act under 4(1)(b), where all the schemes, services provided in that particular service center should be displayed, disclosed by the service points. And accountability, who is accountable for anything happens in that service. If I didn't get any service, whom to account, whom to target. I'm not getting this service, and whom to ask to get that service back. So we asked job chart and monthly implementation calendar. Monthly planning implementation calendar is the calendar which has to be prepared for all the central government schemes and state government schemes exceeding 5 lakh rupees of the budget. So this was our strategy. So when we started our intervention in PDS, when we did our survey, socio-economic survey, we came to know that nobody in the community were aware of their entitlement under PDS, how much rice should be given, how much kerosene should be given, what is the amount of rupees they have to give. Then none of the community members knew about this. And what is the time and what is the duration the PDS shop should work. Every PDS shop used to open only on 2 days of a month and used to distribute whatever the grains they collected from the godowns and close the doors of the shops. So people were forced to take leave for that purpose and stand over the PDS shop to take their grains. PDS shops were not inspected by food inspectors. There is, under the job chart of food inspectors, it says that food inspectors should visit that PDS shops to ensure that all the card holders are getting the food grains properly and the food grains distributed from the godowns of good quality or eating quality of having the, take the foods. And there was no GRMs. There was no GRM mechanisms where if they didn't get the food grains, where to complain, whom to complain. If they complain to the PDS shop owner, he said, this is the what I have got, I can give only this much. There is nothing but. If you want, you can go and complain wherever you want. That was the response from the PDS shop owners, but the people didn't know that food inspector should visit the area regularly. So when we started impact, the first thing was we invited the food inspector to that area and asked him to provide the information and give the awareness on the food entitlements to the community. Under this PDS card, if you are card holder of this BPL card, you will get this much of entitlements. If you are having the APL above poverty level card, you will be getting only this much. So this, when the awareness was given by food inspector, people got more strength to express their grievances. See, I have got the card, but I'm getting, instead of 20 kgs, I'm getting only 10 kgs. What happened to my other 10 kgs? So where should I complain? Again, food inspector took the initiative that if Civic is ready to conduct a GRM, he will come and address these grievances. Again, another program was conducted where community was called, government officers were called, and also shop owners were called to that meeting and asked to express what is happening. The people started telling, these are the things. PDS shop owner demands us to bill at least of 400 or 500 rupees.
2 minutes more.
400 or 300 rupees more rather than this PD under entitlements. So after this intervention, people were able to take complete entitlements under things, and after grievance redressal mela, attitude of all the stakeholders, including card holders, department and PDS shop owners changed. And we, as and when during the intervention we applied for, under applied RTI for information, we got food inspectors should inspect the PDS shop, and one PDS shop was penalized. We got 7 government orders regarding GRMs, how it should be conducted. And we got, one of that was the directive from DPR, where separate grievances cell should be installed in every public service agencies. And based on this only, Commissioner of Bangalore Food Department have given the direction to all the food inspectors to conduct GRMs. So this is one of the photograph of GRM. So in the health also, there was no awareness on health facilities, and Anganwadis was not there in both the communities, though there was the Supreme Court order that a community, any community can request for a Anganwadi with 40 children. So people didn't had any in ANMs or LHV for their areas. There were no health checkups. With the process of these things, with RTI and our intervention, awareness on services and schemes in the communities increased. Visits by NMs and LHVs from the sub-centers has started first time after 8 years in the area. Sanctioning of Anganwadis. Anganwadis were sanctioned to both the communities where now people are, children are going to the Anganwadis regularly, where supplementary nutrition is given to the children, pregnant and lactating women. Preschooling is available for 3 to 6 year children. Bhagyalakshmi beneficiaries, this is a project of a scheme for girl babies in Karnataka. Health checkups are conducted regularly now. Employment generation, Anganwadi, in Anganwadi Anganwadi center, there is option of Anganwadi helper can be recruited through within the local level itself. So the local woman has got employment. Coordination between Anganwadi and sub-center has been increased, where again led to the better health access. This is the photographs where first children were playing in the ground, and now they are accessing the Anganwadi services. Thank you.